So this YouTube video is a deep dive into ataxia, improving your understanding and skills at recognizing this neurological sign. It's one of 3 videos. The others were doing deep dives into dysmetria and hypermetria and proprioception. These are neurological signs and concepts that can be quite tricky to understand, so I tried to pick them apart separately. But these 3 things are very closely connected. So ataxia is incoordination or loss of balance due to poor control of muscles. And that poor control is due to a lack of sensory input or a lack of being able to integrate that sensory input to be able to control the muscles. So it's very much a sensory disorder. And it is a term that is not just the name of any gait that looks a bit wobbly and neurological. And that's one of the reasons for doing this YouTube video, is I get a lot of referrals where a vet has described an animal as ataxic when actually they have a weakness or something else wrong with them. And this video tries to address that. So there are 3 types of ataxia: cerebellar, which in old textbooks may be referred to as motor; vestibular, or proprioceptive, which again in old textbooks may have been referred to as sensory, and sometimes you see it written down as spinal, but that's incorrect, because proprioception goes right up from the receptors right up to the brain, and so you can get deficits more than just spinal. But it's true that spinal proprioception is sensory ataxia is probably the most common type that you'll see. So this diagram is meant to explain the different types in a more visual way, really to try to get over the concept that this is disorder of sensory information. So we have that proprioceptive information that's coming in from the muscle spindles and ascending through the spinal cord, and then goes up to the cerebellum, which we refer to as subconscious proprioception, and the cerebrum, which is conscious proprioception. And a deficit anywhere in this path, this loss of this proprioceptive information from the proprioceptors, can give you a proprioceptive ataxia. By contrast, a cerebellar ataxia is failure to integrate all of this information to ensure that the movements are smooth and adjusted in a timely fashion. And so, as I said before, the cerebellum is this fine tuner of muscle movement. So it takes in a lot of information and then makes those finite adjustments. Vestibular ataxia is dysfunction of the reflex pathways of the vestibular system. So anything from dysfunction of the inner ear, right through the vestibular nerve, going through to the brainstem, and ultimately the cerebellum, where that information is also integrated. And the vestibular system, of course, maintains eye, head and body position. So we're going to deal with each of these in types in turn. The first is proprioceptive ataxia. And I'd like you to watch this video here. This dog is worse on one side compared to the other, and that's the right. And you can see there's a failure to control correct placement of the pelvic limbs. There's a tendency to drag those limbs. Failure to place correct foot position. I'm just going to put that video on once more. When he shakes his head, you lose that control. There's a tendency to place that, especially the right pelvic limb, far under the body, and it has increased tone. And this little guy, who's a very favourite patient of mine, is 1 year after a very severe spinal cord injury, a grade 5 intervertebral disc extrusion, and this is his recovery, which is functional, but he still has some deficits. And he has a proprioceptive ataxia, so he has this wobbliness or truncal sway. He has an abnormal stance, tendency for poor swinging of his limbs, tendency to circumabduct, maybe adduct, abduction, crosses his limbs when he's walking, but when you make him turn around in a circle, he fails to cross his limbs, and variable poor placement of the feet. Tendency to fall when he's turning, and this, because of where the lesion is, this overreaching or floating hypermetria. By contrast, here is a vestibular ataxia, another favourite patient of mine, a subject of another YouTube video. She had an acute onset gait abnormality, and I think you can notice that she has a tendency to lean to one side and a head tilt. And often a vestibular ataxia may be described by caregivers as drunken, and indeed, if you have too much alcohol in your system, then that affects your vestibular apparatus and gives you that drunken gait. Vestibular ataxia and all ataxias become more evident when you turn an animal, make them do a more complex action. And that one going in that direction was just too much, and she keeps sitting down. So vestibular ataxia, dysfunction of those reflex pathways of the vestibular system. There's usually, unless it's bilateral, some lateralization. So you see that head tilt and leaning, deviation or circling even to the side of the problem, a wide-based stance, the tendency to stumble and fall, especially when you're doing more complex maneuvers. And in subtle problems, you may not see a problem when the dog is walking straight up and down, or the cat is walking straight up and down. And that's when you should use circling to make that movement more complex, or perhaps even using stairs. So many animals with ataxia will be too intimidated to do the stairs, and in vestibular disease they will use walls to increase their sensory input. So they'll put their wall by the side of the problem. And this little guy here, the owner knew when his signs were coming back, he was being managed for MUO, when she noticed that he started to use the walls as he was climbing his stairs. Cerebellar ataxia is an example here. We can see this a Staffordshire Bull Terrier has a very classic intention tremor. This is due to lack of fine control of muscle movements, and has this characteristic cerebellar gait with a very hypermetric action. Because of his increased tone, this takes on a more goose-stepping quality. Again, the lack of coordination is more evident when you try to circle the dog, really bringing out that hypermetric metria. I'm just going to repeat that video as it's rather short. So we have the intention tremor there, characteristic of cerebellar disease. If you see that, then you know that that is cerebellar disease. So cerebellar ataxia, there is an ataxia and a dysmetria, which in this case is hypermetria, and that increased tone gives you that goose-stepping type of gait. We can see here in this video still the failure to turn accurately, poor placement of the foot, but this dog has normal strength and conscious proprioception. And he also had a menace deficit response, which is again typical of widespread cerebellar disease, and this intention tremor. You may also see other tremors, postural tremor, or titubation, which is a truncal ataxia, truncal swaying and a jerky body movement. So how do we make sense of ataxia? We need to ask the question, is it actually ataxia? Is there a sensory deficit resulting in poor control of muscle? Or perhaps the gait is abnormal because of muscle disease, orthopedic problems, or pain. This is a dog with a polyneuropathy. You can see this sort of narrow-based stance, poor muscling, weakness, and an animal which is weak will also stumble and drag, and therefore just not placing the feet properly or dragging the feet as they're walking isn't necessarily due to a proprioceptive deficit. You have to examine that animal and determine whether there's a conscious proprioceptive deficit. Bilateral lameness is often mistaken as ataxia, and you can get primary muscle diseases which can also have an ataxic look to them. So then you have to decide if the ataxia is vestibular, sensory, or cerebellar. So if it's vestibular, there should be some other vestibular signs, such as a head tilt or other lateralization leaning to one side, for example. In a proprioceptive ataxia, there should be proprioceptive deficits. And in a cerebellar ataxia, there should be other signs of cerebellar disease, such as tremor, dysmetria, menace deficits, that sort of thing. So now it's time for you to try out your skills. Can you identify the ataxias and what ataxia it is? So this is Wobble Watch, the Ataxia Challenge. And I want to thank all the caregivers that permitted the videos to be used or provided videos in this case. If you recognize your animal, then you'll know that that animal is very special to me. Some of my favorite patients are here. So here's an easy one to start us off. Is there ataxia? And what ataxia is this? So yes, indeed, there is ataxia here. And pat yourself on the back if you determined that there was a left-sided vestibular problem. Yes, we have a left-sided head tilt. We're falling to the left. We're veering, almost circling to the left. Very observant ones will have noticed there was a nystagmus with this cat's eyes, but it's more difficult to determine that as is walking around. And no, that is not an intention tremor that you saw there. So there was a kind of slight bobbing movement, but this was not an intention tremor. Proprioception in this case was normal, and this was a left-sided peripheral vestibular disease due to otitis media interna. If you want to know more about this cat, perhaps look at the other video on circling. Here is another one. Is there ataxia? And what ataxia is it? I'm just going to play that video again. So this animal is not ataxic. This is bilateral cruciate disease, and it's not uncommon for neurologists to get referred dogs with bilateral stifle disease. If it's very acute, then they may be even misinterpreted as being paralyzed because they're unable to get up on either limb. So this is what a dog looks like where it's bilaterally lame, and in this instance this dog also has orthopedic disease. And because both limbs hurt, they have that kind of wobbling side to side action because it's difficult bearing weight on either limb. How do you tell the difference? Well, of course, clinical examination, and you find normal proprioception, but you must absolutely fully support the dog's weight, because any animal with a painful limb, if you aren't completely supporting it, then they may have a delay in correcting that foot position just because moving that foot is painful. And of course, you also examine the joints. Here is another one. So, is this animal ataxic, and what ataxia is it? This is a trickier one, but those that know it will know it, which is one of the reasons for showing you here, because it's not something you necessarily get to see very often. This is not ataxic. This is the classic gait for a German Shepherd in particular with gracilis contracture, which is otherwise known as fibrotic myopathy and contraction of the caudal thigh muscles, mainly because we call it gracilis contracture, but I would have to say that the majority of the cases that I see is the semitendinosus as well, or instead of. So this dog had a normal neurological examination, normal proprioception, and a painful tight band in the caudal thigh area. Diagnosis was confirmed by examination under sedation and ultrasound of the muscle. Have you heard of this before? It's a disease which is almost exclusively in German Shepherds. Not known whether or not that's because of a genetic tendency, or maybe their conformation, their angulated posture may put these muscles under more strain, resulting in micro trauma and then contraction. As I said before, it's the gracilis and the semitendinosus tends to affect younger male dogs. And the classic description of this gait is the short stride with this rapid elastic medial rotation. So they tend to go medial rotate and external rotation of the hock and medial rotation of the stifle during the swing phase. Now, older vets like me call this string halt, which is an abnormal involuntary hyperflexion of the hock and the stifle joints. And really, to understand this disorder, you really need to know a little bit of anatomy. So we're going to deviate a little bit from neurology here, and I'm just going to show you a picture that I've drawn of the gracilis muscle. So it attaches to the pelvic symphysis and then comes down and attaches to the cranial border of the stifle. It kind of extends all the way down here with quite an extensive ligamentous insertion rather, and it is involved with abduction of the limb, extension of the hip joint, flexion of the stifle, and also because it kind of joins to this common calcaneal tendon, as we'll see in the later picture, it is also involved of extension of the tarsus. Now, if you imagine that this muscle here, so this is the medial aspect, is now fibrotic and pulled like a band, then you can understand the gait here. So you have a band that's tightened and contracted and pulling up here, so it turns the foot, the stifle in, and if the semitendinosus is involved in particular, results in that hot contraction. So the gracilis is at the back here, then semitendinosus is attached to the ischial tuberosity, and then also comes to the medial surface of the tibia, and also attaches down to the hock at the common calcanean tendon. And so again, if you imagine that this is all contracted, a fibrotic band, that you would get this type of movement when the animal flexed its head. If you want to know more about that, then I would recommend this rather excellent paper by Sarah Wilson that will give you more details. Now, some of you may have been thinking about this disorder. So is this animal ataxic, this German Shepherd? And what ataxia is it? Very favourite patient of mine, this girl. Easier to run than it is to walk, and this is because trotting is a 2-beat gait compared to walking, which is a 4-beat gait. One of my followers asked if it's easier to watch animals on a treadmill. Sometimes, and this is part of the physiotherapy for this disease. And it does help you slow down and see the gait when it's slower, and in particular you can see that pelvic limb action there. You can also see that this dog is beginning to tire, especially as the speed of the treadmill is changing. So yes, this dog is ataxic. This was a T3 to L3 localization with paresis and proprioceptive ataxia. This dog was homozygous for the SOD, one mutation associated with degenerative myelopathy. So she had a hypermetria due to this spinal disease in the T3 to L3 region, in particular dysfunction of the general proprioceptive tracts and the upper motor neuron tracts, giving you this floating, overreaching action. Now compare that to the string halt gait. Hopefully you can see the difference. This is a floating with extension of the limb, whereas this is a contraction. And she also had the proprioceptive deficits, tendency to knuckle the paws and scraping the toe limbs. Of course, many of you would observe that she already had boots on. So, is there an ataxia? And what ataxia is this? If there is an ataxia. So yes, many of you will identify that this animal is not ataxic. The dog is tetraparetic, has quite a short strided gait, and she has a tendency to sit down. And I think you will have noticed the marked tremor, which is not an intention tremor or a cerebellar tremor. This is a result of neuropathic disease, a previous neuropathy, which was acute polyradicular neuropathy. This is a neuropathic tremor. It's a postural tremor and an orthostatic tremor in this case, associated with that muscle contraction due to weakness, associated with the healing actually in this disease. So you can see with this dog she has excellent coordination. Obviously that's me sitting there throwing her little treats, and you can see that she has very accurate placement of her feet, and is well coordinated. So this is not an ataxia. So is there an ataxia, and what ataxia is it? So, yes, many will have identified that this animal is indeed ataxic, and again there are vestibular signs which are to the left, a left-sided head tilt, falling to the left, veering to the left, actually slightly hypermetric on the right, so there may be a cerebellar component to this as well. This dog had multifocal disease that was mostly a left-sided central vestibular disease. He had a proprioceptive deficit that was abnormal on the left, more than the right, was bilateral. So, left vestibular ataxia. So, in this dog, is there an ataxia? And what ataxia is it? So perhaps a more challenging one to localize. I think it's fairly obvious this animal has ataxia, but where is the ataxia? Because there's variable signs. Many of you will have noticed the vestibular signs. This dog has a head tilt, but what side is it? Tends to change. Sometimes it's to the left, sometimes it's to the right. Sometimes she falls to the left, sometimes she falls to the right. That's because it's bilateral vestibular disease. Many of you will have also noticed there are cerebellar signs like dysmetria, increased muscle tone, and truncal sway with titubation, typical for cerebellar disease. And this is bilateral vestibular cerebellar ataxia, because of course the vestibular apparatus goes into the cerebellum, and so when you get disorder of the part of the cerebellum that's involved in integrating the vestibular pathways, then we can have both cerebellar signs and vestibular signs. So a vestibular cerebellar ataxia, in this girl's case, it is bilateral, so she has a head tilt to both sides. She has this dysmetric gait. If you have the cerebellar signs just on one side, then you will have an ipsilateral hypermetria, which is opposite to the side of the head tilt and the leaning as in this dog's, and that's because the vestibular signs are paradoxical. As you get here, just repeat this little guy's video again. See, the head tilt is on the right, but the hypermetria in this dog is much more pronounced on the left. This was this little girl's disease. You can see here, just put the little image of the cerebellum in there. So we have the feed going into the cerebellum. We do a line through there. We can see this high signal in this region due to inflammation in this little girl, who's another favorite patient, and we can see the disruption here of the architecture of the cerebellum. So, conclusion: ataxia is a neurological disease affecting coordination, movement and balance due to a dysfunction in sensory input or processing. There's 3 types of ataxia: proprioception, vestibular and cerebellar. You need to, when you see an animal with an abnormal or to and fro gait, don't just assume it's ataxia. You need to rule out weakness, lameness and muscular disorders, and use your other neurological signs to localize your problem. Thank you very much for your attention, and if you like quizzes, then I would suggest you go to the sister video to this, which is making sense of circling and why this animal is spinning. Thank you very much.